So today we'll be doing clerking on antenatal booking. Antenatal booking is a gynecological clerking. So like about twice now, repeatedly, they've asked twice or three times already. They've asked antenatal booking in Mdcn exam. So it's a very high yield topic. We should know how to clerk. So this is a gynecological clerking, and don't forget the gynecological history is very important here. The obstetric history is very important here, and the gynecological history. So unlike the other where we don't do the gynecological and obstetric history, so today we do gyne and obs history, but everything still follow the same pattern. So you want to greet your what? Greet the examiner. Okay. Then you greet examiner and the patient also. Okay. You want to do what? You want to greet. You want to talk to the patient, to greet the patient. Then you want to create a rapport. You want to seek consent. Just the same way we do it before. So you get good afternoon, sir. Good afternoon, ma. You introduce yourself. Introduce yourself, your name. Okay. Then you create rapport. And you obtain consent. Okay. So after you are done with this, you want to go to your biodata. You want to ask the biodata from the patient. So doctor, there's two ways of antenatal booking. There can be antenatal booking, like if the person is coming for just a routine checkup, or the person is coming for just a normal antenatal the first time. Antenatal booking is coming for the first time. You understand that you want to be sure if the patient is coming for the first time, and you also want to be sure if he's just coming for a checkup, she has been admitted before. This is very important. So you need to ask the question. So we are going to discuss about these questions under indications of pregnancy. This is very important. So here you want to ask about biodata. You know what to ask under biodata. I don't need to go over it. If you don't know what to ask, go through introduction to clerking. You go through everything. The name of the patient is very important. Name of the patient, the age, the occupation, the address of the patient, the religion, the tribe, then Hausa or Yoruba, the marital status. Please, these are very important questions. The educational level. Educational level. Then after this, you also want to ask about the reproductive profile. I don't need to go through all this again, okay? So for the reproductive profile, you want to ask the patient some basic questions. You want to ask about the LMP. I know some people will say, oh, LMP, you want to ask about the EDD. Some people will say, we are supposed to calculate this ourselves. Yes, but we don't have enough time. Just ask the patient if the patient is aware. Do you know the when last this your menstrual period? Do you know the exact date you are supposed to give birth? Do you know how old is your pregnancy, the one you're carrying? That's the EGA, estimated gestational age. I get me. These are the few questions you're going to ask from the patient. This is very important. You don't have enough time to start using the Nigger's rules to calculate and all the rest. Please take note. And very important, doctor. All these, what matter most is not just asking what is your name, what is your age. You have to you have to ask as if you don't cram it. So you have to be unique when you're asking it. How may I call you, ma? How old are you? What do you do for a living? Do you live around the Ibadan here, depending on where you are doing the exam? Can I know the exact location where you stay? So you don't just want to go there as if you crammed it. So you want to be different a little bit, and you want to make it real. You want to act as if you're actually doing it for real. This is very important when you are doing your OSCE stations for clerking. Okay? So after you've asked for the reproductive profile, the next thing is you want to ask for the presenting complaint. So the presenting complaint is what you want to ask for. So in this case, the patient might not have a specific presenting complaint. Obviously, the patient will have or not, depending. But here you want to ask, do you have any current complaint? So you want to ask, do you have any, let's say, current complaint? Okay, that's the question you want to ask. Then after this, you want to ask some specific questions. These are indication to pregnancy, we call them. So indication to pregnancy. Why is a woman having the pregnancy in the first place? What are the indications to it? Okay, so you want to ask questions on indication of pregnancy. So what are these questions that you want to ask? First, you want to know this pregnancy the woman is carrying, was it planned or unplanned? Was it a planned or unplanned pregnancy? You want to ask her. The next question you want to ask under indications of pregnancy is it the first time the person is coming or just the person is coming for a routine checkup? If the person has been coming to the hospital before. This is very important, okay? So you want to ask, is this the first booking or just a routine checkup? Question mark. This is very important, okay? So another thing you need to ask is, you want to ask the mode at which they achieved the pregnancy. Was it a natural method? Was it via VIF? You understand? In vitro fertilization, you want to know. So you want to know, was it a natural method? A natural method or IVF, in vitro fertilization. So you want to ask the patient. So very important, after asking these first three set of questions, also you need to ask the question, how, when, and where was the pregnancy confirmed? This is very important, okay? So you want to ask the patient, how was the pregnancy confirmed first? When was it confirmed? Okay, and where was it confirmed? Please, these are very important questions. You understand, doctors? These three sets of questions are very important questions you want to ask from the patient before you start the necessary thing you need to start. In so many cases, in this case, if the woman is coming for a routine checkup, she might have a concurrent complaint. But in real cases, in most cases in your exam, the patient will not be having a presenting complaint. So you just ask the reproductive profile and you move to indications of pregnancy. So this is the first set of questions you want to ask from the person. Please take notes. Okay. So the next thing here would be to discuss about the pregnancy symptoms. So we are done with the first part, with the first set of questions you want to ask the patient. So here's the case. This patient, let's assume this patient is coming for a routine antenatal booking. This is the first time she's coming. So we are clerking her for a normal antenatal booking. Okay? So I'm going to indicate where the question will be different. Okay? So here, this is the first time she's coming. So you want to ask about the pregnancy symptoms. So the pregnancy symptoms, what are those symptoms somebody who is pregnant will be having? So here we want to rule it out. Doctors, can you hear me, please?
Yes, sir.
Yeah. So the pregnancy symptoms could include things like what? Early morning sickness.
Early morning sickness.
Yeah. So you want to ask the patient, have you been experiencing any early morning sickness? So I always say this, in this exam, what matters most is you must be confident and you must ask your question appropriately and you must be time conscious. You don't have much time, so you must be time conscious and ask, and you should be audible. This is very important when you are clerking. So you want to ask, have you been experiencing things like early morning sickness? Morning sickness. So you want to ask things like nausea. Maybe the patient have been feeling nauseated, nausea and vomiting. Okay? So you want to ask about early morning sickness if the patient has been experiencing it. So what other thing, doctors? Cravings. Cravings. Yeah, craving is very common. So you see when people are pregnant, they go through craving. So you want to ask, do you have any cravings? Do you understand? So people in my experience, maybe they want to eat this kind of food, this kind of diet or something. So you want to rule it out. So apart from craving, what other things? Pregnancy symptoms. There are a lot of doctors. What other things should we ask the patient?
Sometimes have increase in body temperature.
Yeah, running temperatures, possibly. Okay. What other things? I can't hear you properly, doctor.
Frequent urination.
Oh, yes, increase in frequency of urination because of the enlarged organ in the abdomen. So you want to even ask about, have you noticed any enlarged abdomen? Yes. Any increase or let's say enlarged abdomen. Enlarged abdomen. Apart from enlarged abdomen, you want to ask about things like weight gain. Weight gain. Things like hypersalivation, like you see people who are pregnant, they begin to spit up and down. Hypersalivation. So some of the pregnancy symptoms, you want to ask about that. Swellings of the extremities. So any leg swelling, there are a lot more. What else? Acne, doctor. Some of them used to have this acne, yeah, any rashes or acne. You want to ask, do you notice any, let's say, acne or rashes in any part of your body? Any acne on the face? What other thing? Fetal movement, very important. So you want to know, some people are coming late. So after quickening, you want to know. So have you felt any fetal kick or any fetal movement? So some of the questions. How many questions have we asked now? We've asked how many? 1, 2, 3, 4, 5, 6, 7, 8. Let's make it 10. So we've asked about weight gain. There are a lot of questions you can ask somebody who is pregnant to rule out pregnancy symptoms. Frequency of urination, as you said, we've not written it. Any increase in urination frequency, to rule that out. Breast fullness also. Do you notice your breast is full? Or you want to say, have you noticed any, let's say, any fullness or any breast fullness? Have you noticed any breast fullness? So that is how many? It's 10 already, right? You want to, there are more. Mood swing. I want to ask, have you
Constipation, mood swing.
Yeah, have you been experiencing any mood swing? You understand? So there are a lot of questions you want to ask these patients. Some people don't eat some certain part of some certain food, and so on and so forth. This is about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 11 questions. So you really don't have much time, but this is enough questions to ask when you are clerking the patient. So immediately you are done with pregnancy symptoms. Another thing you want to ask about, you want to tell the patient also about investigation. If the woman is coming for a routine checkup, you want to ask, have you done this? Have you done that? Have you done that? Do you understand? But if the woman is coming for an antenatal booking,
Yes, doctor.
the question will be different. So you want to tell you will do this, you will do that, you will do this, you will do that. I don't know if you get the difference between both. Do you understand what I'm saying?
Repeat that again?
Eh? For investigation, this is investigation.
Yeah, can you?
Oh, what I said is for investigation, if the woman is coming for a routine checkup, so you want to confirm what she has done. Have you done blood grouping? Have they checked you for HIV? Have they checked your BMI? Have they done this? Have you done this? That is if the woman is coming for a checkup. So that means she has been booked before. But if the person is just coming for the first time and she needs to be booked, so you want to tell her, like, okay, we're going to check for your malaria, this thing, we're going to check for your PCV, we are going to check HIV level and check your HIV status, we are going to check for syphilis, you are going to be giving this toxoid, you're going to be, you understand? Do you understand the difference? Hello?
Oh, yes, I get you. Thank you.
Okay.
Yes, doctor. Thank you.
All right. So what are the investigations that you probably do here? There are a lot of investigation, a lot. Things like malaria, very common. You need to do prophylaxis of malaria in pregnancy. So you want to check for the malaria parasite, you want to do the tick or thin blood film, or you want to do this test that they use, acridine orange test. So any of them, you want to do malaria test. You want to check glucose. You shouldn't be you want to do probably things like OGTT test, oral glucose tolerance test, all those things. You want to do the blood test. You want to check for the PCV. You want to check things like what, doctor? HIV. You want to do ARH, the resource factor, the compatibility.
Yeah.
You want to check also. You want to do things like syphilis test. Do you understand? You want to do things like urinary. You want to do things like blood grouping, blood group, and cross match. Blood group and cross matching. You want to do things like what again, doctor?
Yeah.
Things like you want to check for the urea.
Ultrasound.
Urea.
Ultrasound.
Yes, you want to do things like ultrasound. What else? You want to check the BMI, the blood pressure. Pressure. You want to check the BMI of the patient. You understand? You want to give some certain immunization, like tetanus toxoid. So you want to immunize. Immunization. So immunization in pregnancy, things like tetanus toxoid. This is very important. etc. These are the major ones. You want to give medications. Medications like what? Like your iron. You want to pay to start iron. You want to give anti-malaria, prophylaxis. So these are the investigation you do during the pregnancy. So these are the things you want to tell the patient. You do the malaria test, check for the glucose, take your blood to check for your PCV, do HIV test. But if the person is coming for booking and for routine checkup, you want to ask, have you done malaria test before? Have you done any ultrasound? Have you taken your blood pressure and check your BMI? Did they give you any immunization for tetanus or anything? Did they take your blood for blood group and cross matching? You understand what I mean, doctor? So this is how you ask the questions when it comes to all these things. I don't know if you understand what I'm trying to insinuate. Hey, doctor.
Yes, I understand. Thank
All
you,
right.
doctor.
Yeah. So at this point, any question before we continue?
No.
Okay. So after this, you are almost done. The next thing you want to ask is, you want to ask for the obstetrics and gynecological history. So obstetrics, obs, and gynae history. So I always say it's always logical to start with your what? Gynae history. So you want to start with the gynae history. So what are those things you want to ask under the gynae history? These are very important. You want to ask things like what? Menarche. So for the gynae, you want to start with the menarche. So you want to ask the patient at what age did she foresee her menstrual period. So you want to start with menarche. So the age, or at what age did you first see your menstrual blood flow? You understand? So you want to ask about the menarche first. So after menarche, you also want to ask about the duration. How long does your flow last? How long does your flow last? I always say this, when you ask questions, always back it up with things like, you ask how long does your flow last. So you still need to ask questions like, okay, is it for 3 days, so the patient can understand what you're actually saying. So you want to ask, is it 3 or more days? Or more days. So you are asking more questions so the patient can actually know what you are trying to actually ask. So another thing you also want to ask is the whole length of the whole cycle. So how long does it take to get, or let's say, how long does it take before your flow? So you want to ask, is it 28 days, more or less? You want to ask so the patient can know what you are actually talking about. Do you understand, doctor? Hello. All right. So the next questions you want to ask the patient is about any pain during the menstruation. So dysmenorrhea, any pain during your flow. You want to ask these questions. Another things you want to also ask, or you want to rule out, is you want to ask about any use of oral contraceptive pills. Any use of OCPs. You want to rule that out also. And apart from that also, very important, you also want to rule out things like abortion. Any history of abortion. You also want to ask things about pap smear, if the person has done pap smear before. Have you done pap smear before now? So you want to explain what pap smear means to the patient. Some of the patient might not understand, like you make it simpler, like have they examined you and they take something out just to examine for cancer, any cancer screening before? Do you understand, doctor? So these are the main few questions you also ask. After these major questions, there's some, in summary, these are the main questions you want to ask the patient. There are still some other questions you may actually want to include. You might want to also include things like dyspareunia, also is very important. You might want to include things like dyspareunia. Please take notes. Okay. Have you ever done pap smear before now? Okay. So you want to abortion, sorry. Abortion. So you want to include things like dyspareunia, any pain during sexual intercourse, any pain during sexual intercourse. It's also important to rule out that. And also you want to rule out anything like family history of infertility and the rest. Any family history, sorry, any family history of infertility. Doctor, please, can you hear me? Hello.
I can hear you.
All right. So in summary, these are some of the main questions you want to ask the patient. You can ask for any abnormal vaginal discharge, those common gynecological questions you want to ask. But these are the main ones. You don't really have much time on that day. So you need to be as fast as you can and round up and move ahead. Do you understand? So you want to ask about things like history of abortion should be a bit below. Should be a bit below here. Let's put history of abortion here. You want to ask about abnormal vaginal discharge. Any abnormal vaginal discharge. So all these are asked under gynecological history. Please take notes. Please take note. These are all gynecological history. So I always assuming it's better to ask your gynae first before your ops. So once you are done with your gynae, you want to ask for your ops history. So please, these are the major things. You don't, all this abnormal vaginal discharge might not necessarily ask it, but just keep and make it snappy. But the other major ones are very important questions you need to ask your patient. So for the obstetric history, the ops history. So for the ops history, you want to ask about the previous pregnancy. So let's start with the previous pregnancy. So in the last pregnancy, if the woman has given birth before, you want to ask, how was the pregnancy achieved? How was the pregnancy? How was the conception? How was it achieved? Was it cesarean section? Or was it normal vaginal delivery? Was it through C-section or just normal vaginal delivery? Okay, so these are the first set of questions you want to ask. And even during the pregnancy, was there, did the woman attend all the antenatal care? Did you attend the whole antenatal visit? This was about the previous pregnancy. You understand? And you want to also ask, during the delivery, was there any complication? During delivery, was there any complication? You want to ask, how was the child? You want to ask about the state of the child. You want to ask how long the woman stayed in the hospital. Was after the delivery, did the child cry him or herself or forced to cry? You want to ask, do you remember the weight of the child? These are very important questions. And apart from that, also you also want to ask if the mother remember the weight of the child. And you also want to ask, hold on, let me pull this up, the weight of the child, and how long did you stay in the hospital after delivery? These are very important questions. So after delivery, you also want to ask about some certain family history, like family history of twinning. This is very important questions. So you want to ask any family history of twins. These are very important questions. Please take note. It's a very, very, very paramount question. So you also want to ask the status of the child right now. Very important. So is the child alive or dead? This is very important questions. And please don't forget, while asking this, it's important to also ask about the sex. So do you remember the weight of the child and sex? Let's just put it, and sex of the child. And how did you stay? How long, please? How long? How long did you stay in the hospital after delivery? Any family history of twins? Is the child alive or dead? So in summary, doctor, this is what you need to ask in your ops and gyne history. So for any gynecological clerking you are doing, always ask these two. You should always, before you move to the next thing, before you move to the previous family history, before you move to the previous medical history, all those ones are always constant there. Please, if you are going to be going through this video later, I will advise you, thoroughly go through introduction to clerking, so you understand what to ask under previous medical history, previous family history, social history, drug history, allergy, or any history of blood transfusion, surgical history. So those are the things you need to ask. Then systemic review. So after this, after gynae history, that is when you go to those parts. Those ones are always going to be there. This one are always going to be there for any gynecological clerking. So I always see this part as a bonus if you have any gynecological clerking. And some people, there's high chances for you to forget all this whole thing. People forget it. People will just skip it. So it's very important for you to ask any questions here. This is very important. So for gynae history, you want to ask about the menarche. At what age did you first see your menstrual blood flow? How long does your flow last? Is it 3 days or more, or 5 days? How long does it take you to get? How long does it take to get before you? How long does it take you? Does it take you? Hold on, I think that's a typographical error there. How long does it take? Hello, can you hear me, doctor? How long does it take you before the next flow to get before the next flow? Before the next flow. Is it 28 days? So this is talking about the cycle, the total length of the cycle. The cycle. Okay, please, you're asking about the cycle here. So any pain, you want to ask about any pain, dysmenorrhea, any use of OCPs, any abnormal vaginal discharge, any pain during sexual intercourse, dyspareunia. You want to ask about any family history of infertility, any history of abortion, have you done pap smear? That's it. Then you move to the next one here, which is your ops history. You want to ask about the previous pregnancy. How was he achieved? Was it cesarean section or vaginal delivery? Did he attend the visiting the antenatal clinic? Was there any complication after delivery or before delivery? After the delivery, was the child cry on its own, or was it forced, or was it resuscitated? Do you remember the weight of the child and the sex of the child? How long did you stay in the hospital after delivery? Any family history of twins? Is the child alive or dead? So these questions are important, please. I think I'm repeating this over and over, but please take note. I'm just trying to let us know how important it is. So for the rest one, I don't think I need to go over them. For those of us that will be going through the video, I will advise us to go through the other section, the next part, so we can end it perfectly for our gynae history. After this ops history, the next thing will be your what? Let me just write it down. The next thing will be your previous medical history. So under previous medical history, you want to ask about SHADE. That's the acronyms you want to ask. Sickle cell, hypertension, asthma, diabetes, and epilepsies. Then you also want to ask about any surgical history. Any surgical history, any history of blood transfusion, history of blood transfusion. You want to ask about any drug allergy, if the patient is currently on any drug right at that moment. You understand? You want to ask about the family history, please. Here you want to ask about also the same SHADE. You want to ask about the number of siblings. You want to ask about if anybody in the family with same disease, with same conditions. Then you also want to ask about the social history. So under the social history, you want to ask about if he drinks, smokes, and the social lives and everything. Then systemic review. Systemic review is just each system, you ask at least 2 symptoms, maybe CNS, any headache, any blurry vision, or anything like that. Maybe you go to GI system, gastrointestinal system, you want to ask about any nausea, any vomiting, at least two symptoms from each system like that. Then at the end of the whole thing, always end your clerking with thank you. Okay? So, Baba, any questions? Sorry, doctor. Hello? Any questions? All right. Hello, can you hear me, doctor?
No question, doctor.
All right.
Yes, doctor.
So, for those that will be watching this video subsequently, if any question, kindly type and let me know. All right.